So as Monica mentioned, I'm going to speak to you today about how you can scale up entrepreneurial solutions to development challenges. So it's kind of a mouthful title. Let me get to the screen. There we go. So these are a lot of buzzwords. I think we've all heard a lot of them thrown around. I have the fortune today to go after a full day where we discussed quite a few of the big development challenges that the world faces. And we know that these are massive challenges. We've also seen a huge number of very creative and entrepreneurial solutions to these challenges, but there's a gap between these innovations and the scale that they need to operate at in order to address these global challenges. So I'm going to focus today on that process of scaling. And in particular, I'm going to focus on how social enterprises have achieved some level of scale with their solutions. Before I get into a discussion of the broad lessons learned, I wanted to start with a bit of a personal story. How I got into the world of social enterprise and impact investing. So just over a decade ago, I was working for a not-for-profit, socially oriented venture capital fund. It's also a big mouthful. They had made an investment in a startup social enterprise in Mumbai, India called Zikitsa. It was a private ambulance company. It was also branded as Dial 1298 for ambulance. It was a modest startup. It was founded by 5 different Indian entrepreneurs who recognized that there was a big gap in emergency healthcare in their home city of Mumbai, India. Like many of these social enterprises, it started from a personal experience. One of the founders, Shafi Matar, had an ill mother one night. And he had studied overseas. He knew about the London ambulance service. He knew about the 911 emergency service in the US. So he picked up the phone to call an ambulance to get his mother to the hospital. But there was no national phone number in India. There was no 24-hour-a-day, 7-day-a-week ambulance service. So he started dialing hospitals. Some hospitals had individual ambulances. Many of them didn't operate at night, or were out on call, or would only take his mother to their hospital, or the driver was asleep. In the end, he drove his mother to the hospital himself. And he started talking to some friends about his experience afterwards. And like good entrepreneurs, they decided not to wait for somebody else to start up the solution. They decided to start a company themselves to provide 24-hour-a-day emergency medical service in Mumbai. So they pooled some of their own money together to get this enterprise underway. They bought a few vans. They had them painted. They bought some equipment to put in the back. And they began running a pilot service in the city. They started in very modest beginnings. They were stretched for capital, so they looked for off-the-shelf solutions. This is the call center, the 24-hour-a-day call center. They used Microsoft Excel spreadsheets to track their ambulances. They put off-the-shelf GPS units in those ambulances and were able to track them using Google Maps. Spent very little money on that, but used available technology. They got, importantly, advice from the London Ambulance Service. That's a UK government-run emergency medical service that was happy to share best practices around how you run an ambulance service. So they benefited from a collaboration with a government agency. They operated out of the ground floor of a house that the local authorities told them they had to move out of before the next monsoon season because it was in danger of collapsing. But the rent was low. They could use it as storage. They could put all the administrative staff in and really focus their scarce resources on operating the service itself. They tried some guerrilla marketing. It was basically graffiti advertising the ambulance company. It didn't exactly convey the quality of the service that they were offering, but it was low cost and easy to do. But at some point, they realized they needed more capital and expertise to get their business to the next level of scale. In a city of 20 million people, they estimated that they needed about 70 ambulances positioned around the city to be able to reach any emergency case within 10 to 15 minutes. They had come to the attention of the venture capital fund, Acumen, that I was working for at the time, and Acumen ended up investing in the company to get it to the next level of scale, to move this company from having about 15 ambulances on the road to about 70 ambulances. So with that capital, they started to improve their marketing. They got more professional materials that conveyed the brand and the quality of what they were trying to offer. They were able to buy new uniforms for their staff so they could when interacting with customers show the level of quality that they wanted to offer. They began collaborating with a lot of different organizations to get the word out. So it's a little bit hard to see, but this is a road sign in the middle of Mumbai. They worked with the local authorities to put a message up on the board that says, for an ambulance, call 1298. They worked with the Mumbai Sheriff's Office. The sheriff at the time was passionate about emergency medical care, and they were able to use her platform to get the word out for free. They collaborated with the local railways, which transport over 5 million people a day to their jobs, and where there are actually a lot of emergency cases, and were able to park their ambulances at railway stations around the city to be close to terminals where people might be ill and need emergency medical service, but also close to a lot of residential neighborhoods. So by collaborating with city authorities, they were able to get the word out more and get to the next level of scale. And they kept innovating like good entrepreneurs do. You can see a solar panel on the top of this ambulance. That was one of their cost savings measures. Rather than after doing an emergency call where they're running equipment off of a car battery, rather than driving around the city to recharge that battery, they could use the solar panels to do that and save money on gasoline. They also sought corporate sponsors for their work. On the side of the ambulance is an advertisement for a life insurance company in India. You can imagine why a life insurance company would be interested in an emergency service. Importantly, this was not a CSR initiative from the life insurance company. This was a business decision. Their marketing team had to run this opportunity through the regular process to understand whether it was cost effective in reaching a lot of people compared to other marketing alternatives. And they decided that it was. So that was a business decision by the life insurance company to sponsor the ambulance service. And this was an important source of revenue for this company to keep growing. So by the end of my time there, the company had scaled to close to 70 ambulances in Mumbai. They had begun to introduce service in the southern Indian state of Kerala. And they were beginning to look at other cities around the country to expand the service. They weren't content with just reaching one city in the country. They had an ambition of serving all of India and then expanding beyond India into other countries in South Asia and the Middle East. Their scaling story could have ended here. They were seeing steady growth of their entrepreneurial model. They could have continued to grow incrementally in Mumbai as well as in other cities. But an opportunity arose. State governments started to realize the importance of offering emergency medical services to their own constituencies, their own citizens. And they started offering contracts for a public-private partnership. Because Dial 1298 for Ambulance had focused a lot on quality of service and on keeping costs down, they could do a competitive bid for these contracts, and they started winning some of these state contracts. Now, 10 years later, the company has over 3,000 ambulances on the road in India, reaching over 300 million people. They have 10,000 employees, and they have ambitions to now take this service to other countries. So this is just one example of a social enterprise that has achieved scale. Not in the way that the entrepreneurs who founded it may have envisioned going to scale through a purely private model, but by taking advantage of an opportunity to collaborate with government to achieve that scale. You can see some of their modern ambulances here. So I am now working at Mercy Corps. We are a global not-for-profit organization that's focused largely on humanitarian work and long-term economic development. At Mercy Corps, we believe in helping communities solve their own problems. And we recognize that entrepreneurs in their own communities are a key part of solving these big challenges. Entrepreneurs are nothing if not problem solvers. But we also know that entrepreneurs who can create incredibly innovative solutions often struggle to scale. I would argue that we actually as a world have a really well-functioning ecosystem to encourage innovation. We have no shortage of really good solutions. What we don't have is an ecosystem that can really support scale of those solutions. And just a couple of examples that always occur to me: water filters. I don't know how many times you've seen a news article out there that says this new water filter has been created that will deliver clean drinking water to the world, problem solved. But we still have a problem with dirty drinking water because these solutions have struggled to scale. Eyeglasses. A lot of you are wearing glasses in the room. Very old technology, very innovative, solves corrective vision problems. Very unusual to see glasses in many countries around the world. This is a simple, innovative technology that has also struggled to scale. So the question is, how can we get some of these solutions to the scale of the challenges that we're facing? Well, at Mercy Corps, we've decided to invest in early stage social entrepreneurs. We provide equity capital at a seed stage to for-profit social entrepreneurs, and then we provide other support on top of the capital to help these entrepreneurs begin their scaling journey. So many struggle at a seed stage to get the capital that they need and the other support that they need to start going to scale. As you can see, Pula is one of our investees, among others. We've also run a funding partnership that provided grants to not-for-profit social entrepreneurs, which are also an important part of the scaling story. A couple of them are represented here in the room, One Acre Fund, Living Goods. These are organizations that have continued to innovate and have actually achieved incredible scale with their solutions. So I'm going to talk a bit about some of the lessons that we've learned from this set of social enterprises. In figuring out what it takes to scale, we've been collaborating with Duke University's Center for the Advancement of Social Entrepreneurship. They have been publishing a series of reports on social enterprises and their journeys to scale. So the first report, called Pivoting to Impact, all available at this website, looked at some of the commonalities across social enterprises that are achieving scale. They've also done some very in-depth case studies on social enterprises. These scaling snapshots are briefer case studies. These are wonderful to read because they show you the journey that social enterprises have taken, the challenges that they've faced, how they've overcome their hurdles. And then we started to produce thematic studies. So we've already produced one study on how social enterprises finance their scale. I think we're under no illusion that money is a big constraint to scale. So how, as a social enterprise, can you access the capital that you need to grow? The second thematic study was on partnering with governments, which is a surprisingly common pathway to scale, as you see from the ambulance company example. The third study is coming out on Monday. It's about human resources, getting the right talent that you need as you're scaling. Your talent needs change as you grow. And the final case study, or thematic study, which will come out next year, is on the use of data and how savvy social entrepreneurs are utilizing data to understand the impact that they're having and to keep their costs low as they scale. So I encourage you to read these. These are written, by the way, for practitioners, for social entrepreneurs themselves who are facing challenges, and they include a lot of wisdom from social entrepreneurs who've gone through these scaling challenges. So what have we learned from all of these examples? Well, a few high-level thoughts. First, this journey to scale is not linear. I think it's easy for us to think about the Facebooks and the Googles of the world that developed a cool solution and then just shot to scale easily. That is not the case with many of the solutions that we're looking at. We also often think that iteration occurs at the pilot stage, and it does. So a lot of enterprises are out there iterating on their model early on until they get it fixed, and then they're ready to take it to scale. But that journey is not linear itself. Iteration continues to happen as organizations try to go to scale. Let me give you a couple of examples of this. Evidence Action is an organization that implements several different proven approaches to addressing global development challenges. We had supported their work to install chlorine dispensers at water wells in rural villages in East Africa. They had done a lot of gathering of evidence to demonstrate that this is an incredibly easy and low-cost way for people to get clean drinking water. Basically, they put a dispenser in next to a water source. When you go and collect your water, you put a squirt of chlorine in, decontaminates your water, and keeps it safe to drink for up to 3 days. They did a lot of training as they introduced these chlorine dispensers in villages. They'd move on to the next, install another dispenser, do the training, move on to the next, and then expected that people would begin to use the chlorine and it would go to scale. And in the first month or so, people were. But they started to see that usage of the chlorine tailed off over the next few months. So they had to go back and iterate and say, okay, well, what's going wrong here? It doesn't matter that we've installed a great solution if nobody's using it. So they had to go back, retrain people, and they started talking to people in the villages and realized that when they left after the training, there were a lot of misconceptions about the usage of chlorine. A lot of rumors had started, and there was no one there to address those rumors and provide correct information. So they realized, we actually have to do multiple trainings over time before everybody understands the importance of chlorine and what it can do for you. Another example, Visionspring, a not-for-profit social enterprise that sells low-cost eyeglasses in low-income countries. They had been working in Central America for 5 or 6 years, running several different vision shops in cities that sold low-cost eyeglasses. And these shops were becoming profitable, so they thought, great, we're now ready to scale. We're going to take this model, we're going to open a lot more vision shops with the same approach, but we're going to start standardizing the look and feel of these shops. Oh, and by the way, we need to build in centralized administration so that we can procure for all of these shops, so that we have a unified branding image, et cetera, et cetera. As they started adding these shops in, costs went up. And it became too expensive to serve their target consumer. So they had to go back and reconsider their approach, drop that scaling strategy, and focus more on one that includes partner organizations, where Visionspring can be the wholesaler, essentially, to other organizations that have reach on the ground that can then onward sell those glasses to people. That was not their original vision for scale in the region, but they had to iterate as they scaled because they had encountered other challenges. The second broad theme that we uncovered was that social enterprises pursue multiple pathways to scaling. So you can see it from the ambulance company example. They offered private ambulance service where people paid for their service directly, could call the phone number, but then they also started offering their service through public-private partnerships with state governments. We see a lot of social enterprises pursue several paths at the same time to scaling. Let me give you a couple of examples of these pathways. I think one is kind of obvious to all of us. You run an enterprise, that enterprise should grow itself, hire more staff, reach more people. But some of the other examples of pathways are partnering with others. So we had supported a social enterprise in Brazil called Amazon. Amazon takes satellite data that's freely available, converts it into maps that show where deforestation is happening in the Amazon on a monthly basis. And then it partners with municipal governments in the Amazon to show the local enforcement authorities exactly where deforestation has happened over the last month within their municipality, who owns that land, so that if you only have one pickup truck with one enforcement officer, you know exactly where to go and who to go after to enforce. They ended up providing a full information management system to each of these municipal governments that showed them the real-time mapping data and the land registry data, so these governments themselves could take this solution forward into the future. Advocacy is another approach to scaling up a solution. Living Goods is a good example of this. I'm sure Emily will get into some more details, but they work quite closely with community health workers in Africa. And working with community health systems is a very cost-effective way of providing preventive health care. And so they've been developing an investment case to demonstrate to governments that that's a very good allocation of scarce health resources to put it towards community health systems. You see this through Visionspring. They realized that they, as a single enterprise, could not meet the demand for hundreds of millions of pairs of eyeglasses in low-income countries. But that if they could advocate for others to get engaged, that collectively a group of companies and not-for-profit organizations and governments could meet that demand. So they set up a separate organization called the Alliance, which advocates to put vision care high up on the international development agenda and encourage big eye care companies and small NGOs to do what they can to provide eye care as well. So again, that was a path to scale for a solution, eyeglasses, that doesn't need to be scaled up and implemented by a single organization, but can be done collectively through a collaboration. So those are some examples of different pathways to scale. Finally, we saw that many organizations, as they tried to scale their solution, faced very common roadblocks to that scale. Let me give you a couple of examples. They often did not have either the right people or the right systems in place to take them to scale. They had systems that worked when they were small, but not systems that would work when they were large. So at an early stage, they needed to focus on laying the right foundations for the growth that they anticipated. A second example is having good data management systems in place to know if you're having an impact and what cost it is to deliver the service or the product that you're offering. Visionspring did this very well. They still depend on grant funding. Even though they sell their eyeglasses, they're generating revenue from it, they still need some grant funding to operate, to cover their core costs. And they created a metric called the philanthropic investment per pair. Basically said, for every dollar of grant money we get, this is how many people we can reach with eyeglasses. They want to drive that metric lower and lower over time so that they can tell their grant funders that if you give us a grant, we will be able to reach more and more people over time, and we're monitoring very closely our costs so that we can run like a business and achieve more with less money over time. But having good data management systems in place is a key to facilitating scale. Then finally, a lot of these entrepreneurs are always scanning the horizon for other opportunities to grow and scale. This happened with the ambulance company. They were really focused on building their own company up, but an opportunity came along that they noticed that state governments started to put out tenders for public-private partnerships. They jumped on that opportunity. They were able to pivot to another pathway to growth. Finally, as I mentioned, capital is often a very big constraint. At Mercy Corps, our approach has been for for-profit social enterprises to invest seed stage capital, but then also provide other support from Mercy Corps' big global network to help these entrepreneurs get to the next level of scale, because we know that capital is just a part of that picture. What's turned out to be most valuable is our global networks, our contacts on the ground, people that we know in country that we can make introductions to other investors who might be able to provide other capital later in the growth stage of these companies, and to provide technical expertise. These are things that we have in-house that we're able to bring to the table to help social entrepreneurs grow. So I think what's common across all of these is the theme of collaboration and to have multiple parties coming in to help scale solutions. So I've talked mostly about scaling solutions and not about scaling organizations, because no single organization is going to be able to address the development challenges that we face at the scale at which they exist. But working together, I think that we can. And so we've seen all kinds of creative collaborations. Not just Mercy Corps providing venture capital as a nonprofit to social enterprises, but to corporations coming in, advertising on the sides of ambulances, buying from social enterprises as part of their supply chains, providing technical expertise, to governments coming in, realizing that it's very hard often for a government to try something innovative and risky, but if that innovation is tested out by a social enterprise and de-risked, governments can start taking that on and adopting it themselves. And we've seen a lot of social enterprises proactively reaching out to governments and corporates to help them address their needs. So I'd like to end with that vision of how collaboration has helped many of these solutions achieve scale. The 8 social enterprises that we funded through our learning partnership with the Skoll Foundation and USAID, 6 of them have already reached over 1 million people over the course of their lives as organizations. And we would anticipate many more social enterprises achieving that level of scale in the future, if not beyond 1 million people. So what used to be seen as something that was relatively rare, a social solution going to scale, I think is becoming more and more common because of these collaborative efforts. Thank you.